Hey, podcast fam, welcome to the WHOA GNV podcast, the podcast that brings you businesses and individuals that make you go, whoa. As we head into 2022 in a couple months, you may start to see some more bonus content. I think I'm going to do more, on the fly, off the cuff type content. So what I would do is encourage you guys, if you're not subscribed to the podcast on iTunes, SoundCloud, Spotify, or wherever you like to listen, go subscribe to the audio version. I'm not sure if I'm going to do a video every single time, so I might just, get inspired to jump on the mic, say a few words, and release it out there in between our normal episodes and that kind of thing. But I wanted to jump on here and share the results of the COVID-19 vaccine mandate survey that we had sent out. A couple weeks ago, we recorded an episode with local firefighter Bubba Ennis talking about his stand against the city of Gainesville's vaccine mandate. We wanted to get your thoughts, so we sent out a quick survey that had about 130 people respond to it in a very short period of time. You guys are awesome. Thank you so much for doing that. I know that you always get surveys in the mail and stuff, and it always takes time to do it. We try to make it super, super quick, but I appreciate all of you that responded in a short period of time. So we had 130 of you guys. And, this is what we discovered. This is the results, right? The results are right here, so I wanted to jump on here and share them with you guys. The first question that we asked was, do you think that COVID-19 vaccinations should be legally mandated? 51.54% of you said no, it should not be legally mandated. 39.23% of you said yes, it should be legally mandated. And 9.23% of you said that it depends. What was kind of interesting as I was going through the individual responses, looking at the people who said it depends, they really didn't elaborate. We had a little comment box that said, feel free to elaborate any thoughts. And those people didn't really elaborate, which is kind of unfortunate because I would have really liked to hear, okay, it depends on what, like, where's your frame of thought coming from? But we really didn't have any solid, thoughts, additional comments after the question. So, but anyway, 51.54% said no, 39.23% said yes, 9.23% of you said it depends. We then asked, should companies have the ability to mandate vaccines if they so choose? This was actually flipped. It was different. It was 59.23% of you said yes, and 40.77% of you said no. In the survey, we had an open comment box that said, feel free to elaborate any thoughts, like I just said. My team went through and just basically wrote down a whole bunch of the comments here, and I thought I would go through and share them with you now. I'll start by reading, just so you have some context, I'll start by reading their question, the answers to their questions first, and then I'll read their comments, okay? So, do you think COVID-19 vaccinations should be legally mandated? Yes. Should companies have the ability to mandate vaccines if they so choose? Yes. This person said, I'm not typically for mandating anything. I like freedom as much as the next person, but I believe one person's freedoms end where another person's freedoms begin. People deserve to live and not be killed by a disease that's effects can be lessened or eliminated by vaccine. And if the people aren't going to get it by choice, and likely due to the sheer amount of misinformation and false scare, then I believe the government has the right and responsibility to mandate and protect its people. Just so you guys know, if you want my thoughts on all of this, I have them saved at the end, and I'll just kind of give you some of my bullet points and some of the thoughts that I have at the end of the episode. But for now, I'm just going to kind of go through and read the questions and how these people answered, and then their comments. All right, so second person that I have here, do you think COVID-19 vaccination should be legally mandated? Yes. Should companies have the ability to mandate vaccines if they so choose? Yes. Lots of vaccines are mandated for the protection of society at large. The vaccines have been proven safe and effective. Resistance, particularly political resistance, is a danger to our community, especially our children. The third response that I have on the sheet is, do you think COVID-19 vaccination should be legally mandated? No. Should companies have the ability to mandate vaccines if they so choose? Yes. I believe companies should have the ability to mandate the vaccine as long as they are private companies. I feel like the government should not interfere as much as possible with private companies and how they choose to run their place of business. However, I think private companies should also accept medical and religious exemptions. I don't think they should be able to opt out of that. I don't think government-ran companies or facilities should be able to mandate the vaccine because the government works for the people, not one individual who should set all the rules. The next comment was yes and yes on the 2 questions. And they said, I work for the federal government and we have until November 22nd, 2021 to be fully vaccinated. I'm very happy with this requirement because I will be less afraid to return to the office. I have type 1 diabetes and a 7-month-old. We are currently only seeing vaccinated people because I don't want to expose my baby to COVID. We don't know the long-term implications that can result from COVID yet. The next person, do you think COVID-19 vaccination should be legally mandated? No. Should companies have the ability to mandate a vaccine if they so choose? Yes. We are a free country. That means we, the people, have the freedom to decide on these decisions. The next person answered yes and yes to the 2 questions, and they said we have a duty to protect each other, not just ourselves. The next person required yes and yes as well. Their comments were, great societies impose rules and coordinate services that individuals and companies cannot and will not provide. Public health assurance is one of those public goods. COVID is a unique public health threat that can't be resolved by individuals alone. It takes a community commitment to stop the spread. Vaccine mandates commit to stop the spread. Vaccines are our best and safest mitigation device. Yes, they should be required. It impacts me if you don't get vaccinated because A, you may pass it to someone I love. B, you might take up a hospital bed someone I love needs. And C, the virus will persist until human hosts are eliminated from its list of sustainable environments. Next person, do you think COVID-19 vaccination should be legally mandated? No. Should companies have the ability to mandate vaccines if they so choose? Yes. I do not feel the government should mandate companies or their contractors to require vaccinations or other healthcare decisions. I don't have an issue with vaccinations, but I shouldn't be forced by a company via our government. This is abuse of power, in my opinion. Receiving a religious or sincerely held moral belief exemption shouldn't even be a question. Anyone feeling hesitant or resistant should be able to opt out without fear of retribution. What you might see at that point, less people feeling like their hand is being forced and like rebellion against the man is necessary. Do you think COVID-19 vaccinations should be legally mandated? No. Should companies have the ability to mandate vaccines if they so choose? This person says no. Individual rights are paramount, always. A vaccine may well save millions of lives, and it may be a great thing, but mandating it will cost us and future generations liberty we will not soon get back without another horrid bloody war. If for any reason we surrender our right to choose what is best for us and our families, liberty is toast and the scales have just tipped irreversibly toward tyranny. Do you think COVID-19 vaccination should be legally mandated? No. Should companies have the ability to mandate vaccines if they so choose? No. If a woman says that it is their body and their right to have an abortion, why is an individual's right to choose what they put in their body not the same? The next person also said no and no. Freedom is the foundation our country was built on. Mandating a vaccine is taking away our freedom. No one should ever have to choose between their medical freedom and their livelihood. The next person said yes and yes. We are vaccinated at birth. Why is public health not mandatory? One should not be able to opt out and then get others sick. The next person also said yes and yes. All the studies show how effective the vaccine is against widespread COVID-19. We have many other mandated vaccines, and this is the only one that is getting all that much opposition, despite the numbers clearly showing it works. If you want people to stop wearing masks and for things to, if you want people to stop wearing masks and for things to get back to normal, then we have to control the spread, and there is no faster / easier / safer way to that than getting the vaccine. I get the whole freedom angle, but the fact is when you sign up to live in a society, you have to make some compromises. For example, I love hanging out nude, but I have to wear clothes because not everyone in the society would want to see me nude. So unless you have a medical reason why you shouldn't take the vaccine, it is in the public interest that you do. That is a very interesting comment. Do you think COVID-19 vaccination should be legally mandated? No. Should companies have the ability to mandate vaccines if they so choose? No. We should all be afforded medical freedom. We should all be afforded medical freedom. That's part of being a free country. Everybody's health situation is unique. We are all capable of weighing the cost/benefit, risk, and reward of any medical decision. Mandating a vaccine that neither prevents contraction nor transmission is absurd. There was a lot of comments, and it went on. There was several comments. I just told my team to randomly select, both from both viewpoints, or a bunch from different viewpoints. And, I would say that, obviously looking at the charts and the percentages, it's very down the middle. If you care about my thoughts or input, you can keep listening. Otherwise, I won't be offended if you stop right here. Sometimes I've contemplated whether or not to even put my opinion out. I said that in the episode. I'm like, I don't even know if I should put my thoughts out on stuff. But I've decided that, that I'm going to share my thoughts with you guys. And, I'm entitled to my opinion just like others are. And I'll say this, my stance is the same as it was in the podcast episode. I don't think COVID-19 vaccines should be mandated. I'm a long-term thinker and genuinely believe that allowing such things to happen is just giving a little bit of our freedom away. Most people are getting so caught up in the fear that they aren't really thinking about the long-term implications of such decisions. Giving up our freedom little by little will equal a lot of it being given up over time. Again, I think this comes from a CEO mentality of really trying to look long-term and what the effects of having a mandate could be. I'm not anti-vax, I'm anti-vax mandate for sure. Here are a series of bullet points that I've written down about what I've observed over the past few months. These are arguments that I've personally seen the most, and so I thought I would share them, and maybe you agree, maybe you disagree, maybe we can talk about them. But the first argument that I see a lot is someone that is unvaccinated is limiting the freedom of others. But this doesn't really make sense to me, because if you are vaccinated and I'm not, then you're protected, right? Why would you be afraid of me? This got brought up in the podcast episode. You're vaccinated. Unless, of course, you don't have confidence in the vaccine, in which case I would ask, why did you take it? We do know now that even if you are vaccinated, you can still get COVID and spread COVID, which kind of brings me to my second argument, or the second argument that I hear all the time, which is number 2. You have to get vaccinated for other disease. What makes this any different? I've had so many people say, "Oh, you've been vaccinated for polio. Why is this any different?" And that kind of brings me to a thought that I've had and that's come up in multiple conversations. Shouldn't we stop calling it a vaccine and call it what it really is, which is a COVID shot, kind of like the flu shot? People keep calling it a vaccine, but since we know it doesn't prevent COVID and you can still get it and spread it, I personally feel like COVID shot would be more appropriate. In which case, this makes it very different than other vaccines. And one of the comments, someone earlier that I read, someone said, "I have type 1 diabetes and a 7-month-old. We are currently only seeing vaccinated people because I don't want to expose my baby to COVID. We don't know the long-term implications that can result from COVID yet." I would just take the other side of that and say we don't know the long-term implications of the vaccine yet. A lot of people saying it's safe, and that's fine, but there's just no data. There's no data. There's no long-term data because it hasn't been out longer than a few months. So I would just say that we just don't really know the long-term implications of the COVID shot either. The third argument that I have had a lot of people, message me about, and that we've been in deep discussion about, is that everyone should, this is what they, a lot of people say, everyone should get the vaccine because the kids haven't been able to yet. Well, now that you will have the ability to vaccinate your child, I'm interested if this argument will now stop. I've had some deep conversations with people around this, but even if children weren't allowed to get the COVID shot for a long while, the data doesn't really back it up. As of today, according to the CDC, there have been a total of 680 children under the age of 18 that have died from COVID, most of which had underlying health issues already. This is 680 children out of 6.5 million total COVID cases in children, which is of a total of 39 million COVID cases in the United States. These numbers are numbers that I took today off the CDC website and the American Academy of Pediatrics. My point is that 680 deaths in children, with most of those having underlying issues already, from a total of 6.5 million total COVID cases in children, is a very, 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 very small percentage. Of course, it's terrible that anybody would die, let alone a child, from COVID-19. With that said, though, the data just doesn't back up the argument why vaccinating the entire country to save the children is necessary. But now that parents will have the ability to vaccinate their children, like I said, I'm super interested to see if that'll stop. Those who want to go vaccinate their children will have the ability to, and will that bullet point, that argument stop? I guess time will tell. The other thing that I'm starting to hear a lot is that it's all political resistance. One of the other comments said that. And I would agree to a degree, mainly because I don't like being bossed around and told what I have to do. Especially when I believe the government is abusing its power. There are certainly a lot of people that are putting their foot down right now in order to protect freedom. Totally get it. If you're like, man, no, I see all the arguments, right? And sometimes, I'll just say this: I'm just a pro freedom guy. That I'm going to do everything that I can to protect freedom. But okay, now with all that said, put aside the fact that people don't like being told what they have to do. I know plenty of Republicans that have gotten a vaccine, and I know plenty of Democrats that have not. So I do believe that there is an overwhelming distrust of government and the media for that matter, but I don't think the decision to get the vaccine or not get the vaccine is as political as people make it out to be. For some reason, all of this, you guys, all of this makes me think of a multiple choice test, back in school. Do you remember in school, you'd take a multiple choice test and you'd read the first answer, read the first answer and there's the answer and you're like, oh, yep, that's the answer, and you circle it and you move on to the next question. And then you get the test back and you actually find out that the answer was D, all of the above, but you jumped to that first solution, was like, yep, that's it. A lot of this just makes me think of that. I'm not saying that the COVID shot isn't part of the solution, but I don't think it's the whole solution like many people think it is. I also don't come on here acting like I have all the solutions, because I'll be straight up, I don't. But with that said, I do not believe in mandating vaccines. I don't think that's going to contribute to the solution. Again, guys, my personal opinion. I respect yours. Don't let my opinion anger you. To end, I'll just reiterate what I said in the episode, which is that I believe people should do what brings them peace. You guys, if you feel like getting the vaccine is going to bring you peace, then go ahead and get it. Please get it. If if it's not bringing you peace, then don't get it. And that's just where I lie on the issue. Either way, I think we need to work toward having more empathy for our neighbors. I said this in the episode. You guys love your neighbor. We need to have more empathy for them and the choices that they're making for themselves and their families. I'm not going to judge somebody if they are vaccinated or unvaccinated. I'm going to love them either way. And some of these conversations, I've really had to take a step back, pause, and even wonder, just try to put myself in the other person's shoes. I'm like, man, did this person have somebody who died in their life from COVID? Maybe where was this person impacted personally? Where are they drawing their conclusions from? Where are they getting their data from? That's something that I'm asking a lot of people, is where are you getting your data from? I just think we need to be more empathetic. You may disagree with me, I may disagree with you, but I can still give it my best effort to put myself in your shoes and to understand where you're coming from. I said that in my podcast episode. If we can just really try to get to understand each other, even if we disagree, we're going to be much better off. So that's it in terms of this information and my thoughts on it. Finally, guys, I would just say thank you so much for listening. Please contact with me. We would love to get you guys involved in the discussion. Go follow us on Instagram. Go to WHOA GNV on Instagram. Just follow us, connect with us, drop me a message. You can drop me a message there. I'm checking those messages all the time. Again, I'm trying to get, I've had some lengthy conversations in there, and I try to pull people out of those conversations. I try to invite them for coffee to have a discussion. Sometimes they do, sometimes they don't. I've had people say that they're, not following us anymore because of that episode, which is very unfortunate because it's not what we're trying to do. We're trying to just have more conversations that are going to be productive to this podcast, to the listeners of this podcast, and ultimately to our community, because there's a lot of interesting things on the horizon. I'm going to be interviewing David Areola, one of the city commissioners, and I look forward to talking to him about why he wanted to get into public service and just kind of hearing his thoughts on the future of Gainesville. So there's gonna be a lot of great conversations, and that's my intention here, is to have really great, thoughtful, intentional conversations. So again, if there's something you want to talk about, if you think there's something that needs to be talked about, please send it my way. I'm not promising that we will, but I'll definitely take a look at it, and if we can work it in, or if maybe we just do a audio version of it and bonus content or something, who knows? 2022 is going to be definitely an evolution in the podcast. I'd send out a newsletter talking about the evolution of the podcast. I think there's going to be a lot of changes as we head into 2022. Please subscribe to our YouTube channel. If you type in whoagnv.tv into your web browser, it'll take you directly to our YouTube channel. Please go hit subscribe. One of our goals is to get to 1,000 subscribers on YouTube before the end of January, so help us with that goal. And that's it, guys. I appreciate you. I appreciate you listening. Please share this with somebody. Please send me a note. Please comment. And, I love you. I appreciate you. Be neighborly to your neighbors. Love everyone. We'll see you later. Bye.